Then when we look at chiropractors, chiropractic is based on neurological control of the body. The theory is that blockages to nerve flow is the source of many symptoms and conditions. When something is pressing on the spine, or something is torqued in the spine or in the head next to the spine, then a chiropractor will analyze the spine and related areas, determine areas of subluxation, which is an area in which the alignment of the spine is not proper, and that can cause an irritation of a nerve or a frank blockage or pressing on the nerve, and various symptoms and dysfunction occur as a result. So the chiropractor will determine the areas of subluxation, correct the subluxations, and thus allow healing and control by the nervous system to be reestablished. Now, in Berkeley, there are 83 chiropractors. Again, those are the number of chiropractors who have registered their addresses in Berkeley with respect to the Chiropractic Board. And the Chiropractic Board was formed, unlike the Acupuncture Board, by a referendum. So chiropractic is, in the law of California, the same as a constitutional amendment, or like Prop 17. So acupuncturists were brought into licensure by the legislation, by the legislative branch. And so if the legislature decides to get rid of acupuncture, they can. However, it's much more difficult if chiropractic, or if there's the politics of chiropractic, become bad. Those who do not want chiropractic to exist will have a much more difficult time ending chiropractic licensure, because they would have to file a referendum with the state, and each of the citizens would have to vote again on whether they should get rid of chiropractic. So obviously this would be very difficult, because I myself personally think chiropractic is wonderful, and I think most people in the state would agree with that. So at any rate, chiropractic licenses started, I believe 1932 was when the referendum occurred, and so the licenses in Berkeley range from anywhere from number 4,000 to 31,480. And so the first licensees in Berkeley were licensed many, many years ago, some of whom may no longer be alive. But the majority of the people who are licensed as chiropractors have been since 1982, and the number has increased steadily. So at this point, I will entertain any questions you have. I want to thank you for coming and listening to this brief presentation on alternative medicine, the different licensees in this area, in Berkeley, Emeryville, Oakland, the basic philosophy behind them, and then let's talk a little bit about access. Now, there are various ways that people access these services, and one is which by cash. There are some places that accept cash only, such as the community acupuncture clinics, and some of the chiropractic, acupuncture, naturopathic clinics. I think most naturopathic clinics require cash only because insurance does not cover it. There's also the workers' compensation system, a special insurance system set up to help injured workers, and acupuncture and chiropractic are definitely part of that system, and if you have an injury, you can ask for treatment and evaluation by chiropractors and acupuncturists, and it will and should be provided. If someone's in a personal or automobile injury, the insurance that they have, that coverage will pay for acupuncture, chiropractic, and perhaps even naturopathic medicine as well, depending on the circumstances. There's also private insurance. Private insurance may cover all three of the licensed areas. Public insurance includes Medicare and Medi-Cal. And once again, those may not cover naturopathic medicine, and definitely Medicare covers chiropractic, but Medi-Cal covers chiropractic and acupuncture, but I'm not sure if it covers naturopathic medicine. Certainly, Medicare does not cover acupuncture because of the politics. And lastly, there are various medical groups that are associated with insurance plans, and those would include Kaiser and Sutter Health, and some other places like John Muir may cover acupuncture and chiropractic and naturopathic medicine, and it requires a referral out of the system typically in order to get that care. Sometimes there are in-office clinics associated with Kaiser. There are a few Kaiser facilities that do have acupuncture. I don't think they have chiropractic. And Sutter Health refers out. So I want to thank you again for this brief introduction to alternative medicine in the Bay Area, a very significant contributor to the health and the functioning of the people in this wonderful area, by covering licensure, covering training and access, and covering the way that one may have access with respect to the payment by insurance or out-of-pocket cost.